So hi, everyone. I'm Katie Green. I'm the Senior Program Manager for Innovation at the Massachusetts eHealth Institute at the Mass Tech Collaborative, which is a really long name. But we are the digital health ecosystem for the state of Massachusetts in the US. So Mass Digital Health, which is what we call our ecosystem, is a public-private partnership that's working to establish Massachusetts as the leading ecosystem for digital health innovation, trying to drive economic impact and improving healthcare costs and quality for the residents of our state. And Mihai at Mass Tech is the lead sort of public agency for Mass Digital Health. And we work closely with industry and healthcare leaders on activities designed to promote and grow our sector. As I mentioned, Mihai is division of the Mass Tech Collaborative, which is what we call a quasi-state agency, so not sort of fully part of our state government, but very closely aligned with it. And overall, our organization is focused on supporting and improving the innovation and tech ecosystems here in Massachusetts. And with Mass Digital Health, our goal really is sort of to harness all of the areas in which we think Massachusetts excels to support and grow our digital health ecosystem. And so this includes sort of the our healthcare research institutions, our leading academic medical centers, the fact that we have one of the highest EHR adoption rates in the United States. We've got a really strong innovation infrastructure in Massachusetts with, leading accelerators, innovation hubs, testing environments, which I'll talk about more later. We've got a very competitive investment landscape. We also have really strong clusters in sort of the areas surrounding digital health. So obviously we're a leader in life sciences, but also have strong medical device, robotics, cybersecurity, big data clusters here as well. We've got a huge density of universities, colleges and universities here, and sort of the number one state in the country for STEM graduates, which help feed, into the workforce for our companies and healthcare systems. And then there's also the commitment from both the public and private sectors in the form of our digital health initiative to support this ecosystem. So our work here in Massachusetts has really been guided by the recommendations of the Massachusetts Digital Health Council. This was a governor level council put together with representatives from across the ecosystem that issued a report at this point about 3 years ago on ways to strengthen our ecosystem. Our funding comes from a state level fund called the eHealth Institute Fund. This was capitalized by a one-time assessment on health plans and large acute care hospitals in the state. This was done in 2012, so we're still using that funding today, although actively working on sort of working with our government partners on figuring out recapitalization to help us continue forward. The programming that we've sort of led on or collaborated on to meet the recommendations of that Digital Health Council includes we run our web portal for Mass Digital Health that has resources for companies at different stages. We've got a stakeholder directory where we try to capture both all of the companies as well as kind of all of the other supporting organizations in Massachusetts to make it easier for people to see the scope of what's going on here and connect with each other. We have a jobs board solely focused on digital health that pulls all of the open digital health jobs across the state. We have our events calendar, trying to round up everything going on at different organizations across Massachusetts. We also run and publish monthly newsletters with a roundup of industry news in Massachusetts, upcoming events, success stories, spotlights on open jobs. That goes out to about, I think, 800 or 900 people in our ecosystem. One of the recommendations of our council was focused around cybersecurity. So we'd put together a cyber group of experts, which developed a resource guide for digital health companies. That's also available on our website. We invested over $1 million in Mass Challenge Health Tech over 5 years to help them get off the ground and serve as sort of an innovation hub in the Boston area, and also to help them accelerate digital health companies. And because we try to be not just focused on Boston, we support the entire state. We also invested over a similar span of 5 years in TechSpring to serve as the innovation hub for the western part of our state. And then we were instrumental in bringing the health conference to Boston in 2021. So I'm sure some of you attended that. If I didn't get a chance to meet you, hopefully we'll meet at a future health conference, and hopefully it'll be back in Boston one day. Although I'm sure many of you probably prefer Vegas, but and then the primary program we run is our Digital Health Sandbox program. And this program is really aimed at both accelerating digital health companies as well as growing the knowledge base of these R&D centers, what we call sandboxes, again, across the state. And so over the past 3 or 4 years, we've created a network of sandboxes that have all been vetted by us for their ability to do intake and matchmaking, and their ability to support external digital health companies. So they're not just organizations that are kind of supporting their internal innovators. They have to be able to work with external companies. And a lot of we've sort of made sure that they're all equipped and experienced in helping these external companies navigate the sandbox organizations and complete testing and validation projects. We also fund promising validation projects, which I'll talk a little bit more about in a moment. And we've been trying to enable networking, best practice sharing, and connections among the sandboxes in our network. Cool. So right now we have 12 organizations in our sandbox network. As you can see, they span the state with, clustering around Boston. These include universities, including 3 campuses in our state university system, as well as MIT and Worcester Polytechnic Institute. They also include innovation centers and labs at some of our health systems, including Brigham and Women's Hospital and Mass General Hospital. We have 2 payers, Carillon, which is a part of Elevance Health, which is the new name for Anthem, and Point 32 Health. We recently added a senior living facility, which we're really excited about. And then we have MITRE, which is a large nonprofit that runs a number of federally funded R&D centers. And they're a great connection to sort of the priorities and expertise at the federal level. These sandboxes, as you can hear, kind of offer a wide variety of resources and services to digital health companies. So some of them provide access to lab space and state-of-the-art equipment. Many of them offer subject matter expertise in areas including cybersecurity, interoperability, EHR integration, reimbursement models. They can provide access to patients, providers, administrators, other types of staff for focus groups, user experience testing, just overall guidance and feedback for companies. Some of our sandboxes provide dedicated sort of expertise and guidance in designing and running pilots and other human subject research. And some of them provide access to either synthetic or real data sets, which has been very valuable to our companies. So companies, we will do matchmaking and introductions to sandboxes for digital health companies at any time, and those companies can be from anywhere. We do have some funding available for Massachusetts companies to help them cover the costs of working with these sandboxes. That funding's provided on kind of a rolling application basis. But right now, our primary funding mechanism for this program is through our Sandbox Challenge program. And in this program, we're going to be running one challenge a year that's focused on a key priority area for the Massachusetts government. The challenges are open to companies across the US with some preference given to Massachusetts companies. We'll be accepting companies into a cohort and kind of supporting them with sandbox matchmaking, as well as running an introduction to the Massachusetts ecosystem sort of speaker series. And then at the end of the program, the companies will participate in a pitch competition, and we'll be awarding 4 of them $50,000 grants to work with the sandboxes that we've matched them with. And the way our funding works is that we actually provide the money directly to a sandbox to cover their fees. So the money doesn't go to the company, it goes to our sandbox.
Cool.
And the first challenge that we're running right now is focused on healthy aging. And the second one is likely to be focused on women's health. We'll be announcing that in June.
Okay.
So that's a really quick overview of our ecosystem. And here's my info.